7 unusual symptoms of perimenopause. I'm Dr. Jen, double-boarded OBGYN and integrative medicine doctor. I help women every day navigate through perimenopause and menopause and live life to the fullest, just start to feel like themselves again. So let's talk about some 7 unusual symptoms that could be perimenopause. So first, itchy ears. Itchiness all over actually can be a symptom of perimenopause, where you feel like your skin is just itchy and irritated and dry. And believe it or not, inner ear is a small space, and whenever you have the declining estrogen, you get drying of your tissues, which can lead to this sensation of itchy ears. 2, tinnitus or ringing in the ears. So ringing in the ears can be a lot of different causes. So you should always make sure you're evaluated for things like nutrient deficiencies or a viral infection, or various other medical conditions can actually cause ringing in ears. But if not, it could actually be a sign of perimenopause. 3, changes in your body odor. Think about puberty, right? We go through puberty and suddenly things do not smell the same. These changes in our ovaries, in our declining hormones, actually precipitate changes in the microbiome, or the little bacteria that are present on our skin, in our mouth, in the vagina, in our gut. And when you change those microbiome, you can also change body odor. So you may notice that you're kind of having to change different deodorants, or you feel like you smell differently than you used to. Certainly, you can have vaginal odor that has appeared because, again, changes in microbiome can disrupt the odor that you notice. And estrogen is really, really critical for most microbiomes, especially the vaginal health as well as oral health and our gut health. So when we actually decline estrogen, or having decline in estrogen because of perimenopause, we notice changes in our odor. 4, migraines. So you can basically have no history of migraines and suddenly just start having these debilitating headaches, especially ones that you wake up with, or they're in the morning and kind of go away throughout the day. Migraines can actually get worse, both from declining estrogen and progesterone. Sometimes progesterone supplementation, like taking hormone replacement therapy, can actually give people migraines. So migraines are very much affected by hormones. And some women even have cyclic migraines, where they have migraines only starting luteal phase and through their period, but they actually don't have migraines other times. So migraines can be an often sign of perimenopause starting. Next, we actually have burning mouth, burning gums, basically oral health. Again, the microbiome changes because your hormones change. And so this can actually affect the amount of saliva that you produce. It can affect the nerves that are in the oral cavity. It can affect a lot of different aspects of the health of your oral health in general. Actually, women have more disease, dental disease, believe it or not, going through perimenopause, because again, the microbiome changes due to these hormones. And so you may experience now suddenly a cavity or this burning sensation in your mouth or your lips or your gums, all related to both declining estrogen because you're not making as much saliva, but also because the nerves are affected and the microbiome is affected. Next, we have joint pain. So often that is one of those signs that patients notice pretty early, where they say, I wake up stiff. I wake up achy. feel like there's like pain in my bones, like bone pain. And that is also both related to progesterone and estrogen. In fact, estrogen is so critical for bone turnover and bone health in general that when we go through perimenopause and start having especially those fluctuations in estrogen, which, that's part of those stages of perimenopause. So check out my video about stages of perimenopause if you want to learn more specifically about that. But joint pain is a common symptom of perimenopause. Next is heart palpitations. If you saw the little video on Oprah, that was actually one of her very first symptoms of perimenopause, is she started having these flutter sensations in her heart. She felt like she would just be resting and sitting and feel like her heart was racing, almost like she had too much coffee. And heart palpitations are very much affected by both estrogen and progesterone especially because we have receptors in our heart, and progesterone helps to calm the heart down. So when you actually go through perimenopause, you start noticing palpitations or these like uneasy feelings that your heart is racing. Now, there are other reasons for heart palpitations. Certainly at the age of being over 40, you should always make sure that you see a doctor to rule out any arrhythmias, but certainly palpitations can be benign and just related to hormone fluctuations. And lastly, I did want to mention, because though this isn't really sort of unusual symptom, it's something that women often notice, and that's the changes in their weight and their metabolism, that suddenly they're actually having a harder time losing weight, and that everything they were doing from an exercise and nutrition standpoint is not getting where they want to be. So I will always put that in there, because it's sometimes going to be a more subtle change that you notice that you're actually going into perimenopause and doing all the things right from a nutrition lifestyle, but it's not translating. And that's due to this insulin resistance and cortisol hormones that are intimately involved in sex hormones.